Today we are going to deal on most important topics, that is preventable, treatable, avoidable but not curable. So patients who are suffering from this kind of disease, to those individual needs lifelong hormonal replacement therapy. So that is we call as Addison's disease. So let us see, so what it is, so what are the, so what is what it means, and what the causes are, causes and the risk factor for the Addison disease, the signs and symptoms, and what are the diagnostic evaluations, and how we are going to manage the Addison disease. So let us see one by one detail. Now come to the introduction. So Addison's disease also we call as primary adrenal insufficiency, and also we call as hypocortisolism. Hypocortisolism. So there is a decreased, so the cortisol production is there. For that reason it is called as hypocortisolism. When compared with this Cushing syndrome, in the Cushing syndrome, so there is excessive production of, so that is called, so the steroid hormones takes place. But in case of Addison's disease, so there is a less secretion or decreased absence of, so that is the corticosteroids or adrenal hormones takes place. For that reason, it is called as, so that is hypocortisolism. So it is first time, so that is in the year, so 1885, so that is Thomas, the doctor. So the Dr. Thomas Addison, Dr. Thomas Addison, so discovered, so this disease condition the patient. For that reason, so the name given as Addison's disease. He is a physician and a scientist at the, so this Guy's Hospital, London. Okay, so first time identified, so the disease in the year 1885. For that reason, the name given as Addison's disease. So here 1 to 4 people were suffering from, so there is Addison's disease per million per year in the worldwide. Incidence is very low, so compared to the other disease. It is a very rare endocrine, so autoimmune disease. Now come to the meaning of, so Addison's disease. What it means? It means, so Addison's disease, it means there is a less production or a decreased production or insufficient production of a steroids. So especially the cortisol and the aldosterone. Now come to the definition of, so that is Addison's disease. Addison's disease is defined as it is a rare endocrine autoimmune disorder. So the resulting from insufficient or less or absence production of, so that is cortisol and aldosterone. So the characterized by the hypotension, hyponatremia, and that is hyperpigmentation of the skin, and irritability, and the reproductive changes like so amenorrhea is called as an, so that is a disease. Now come to the causes and risk factors. The causes and risk factors. The most important cause for, so that is Addison's disease is, so that is insufficient production or less production or absence of a production of a, so that is cortisol and the aldosterone. Now come to the risk factors. So the infections like tuberculosis, syphilis, and the HIV, and other conditions like smoking and alcoholism, so the tobacco intake, sedentary lifestyle. So stress is also the most important cause for the Addison's disease. Now depending upon the causes of, so that is Addison's disease, it is divided into, so the 3 types. So the first one is, so that is primary adrenaline insufficiency. It is resulting from, so that is kidney, so adrenal glands. Primary adrenal insufficiency means, so the adrenal glands not able to produce or insufficient production of, so that is cortisol and aldosterone from the, so adrenal gland. It is called as a primary adrenal insufficiency. So the second one is secondary Addison's disease. Okay, so in case of secondary Addison's disease, here the pituitary gland. Okay, so pituitary gland not able to produce the ACTH hormone. So ACTH is very important to stimulate the adrenal gland to produce, so the cortisol and the aldosterone. Here the ACTH is insufficient for that reason, so there is no production of cortisol and aldosterone take place. So that is what we call as secondary Addison's disease. Now what is tertiary Addison's disease? Tertiary Addison's disease. Tertiary Addison's disease means here the hypothalamus. Hypothalamus also very important, plays a very important role in secretion of, so that is aldosterone and the cortisol. How means it secretes, so that is adrenocorticotropic releasing hormone, ACRH. In the normal persons, hypothalamus produces ACRH, so that is adrenocorticotropic releasing hormone. By the hypothalamus, it has the effect upon the, so pituitary gland to secrete ACTH, But ACD has adversely effect on the so that is adrenal gland to secrete the cortisol and the so that is aldosterone. But here, so the three defects lead to insufficient production of so that is corticosteroid drugs, corticosteroids. So for example, cortisol and the aldosterone. For other reason, depending upon causes, it is divided into the three types. Now, common thing. So clinical manifestations, the persons who are suffering from Addison's disease. For a mnemonic Addison's the disease clinical symptoms, we are having here the one word, so that is Addison. Addison. A means there is a appetite. It is a decreased appetite in case of a, so that is we are going to see in case of Addison's disease. So the dizziness, and so there is a dizziness and discoloration of the skin. So there is bronze appearance of the skin. So irritability, and the S is nothing but so that is salt. So that is hyponatremia. Sugar. So that is a hypoglycemia. O is nothing but orthostatic hypotension or hypotension. S L is nothing but nausea. So one more word is there. So that is steroid. The same, so that is S is nothing but salt and the sugar, so that is hyponatremia and hypoglycemia. T is nothing but tiredness, and the weakness. So the electrolyte imbalances, so that is the sodium and the, so the calcium, the level becomes very low. The so that is hyponatremia is there. So that is R is nothing but the reproductive changes like a amenorrhea. So O is nothing but the orthostatic hypotension or hypotension. So intimate changes, that is bronze appearance of high pigmentation of the skin, so that is bronze appearance of the skin. D is nothing but diarrhea. Alright, so the dizziness. Okay, so this is regarding to the clinical manifestations. So we are going to see in the persons who are suffering from, so that is Addison's disease. Now come to the diagnostic evaluations. Yes, so what are the diagnostic evaluations we are going to do, identify, or so that is to diagnose Addison's disease. The first one is physical examination. The history taking is very important. ACTS cortisol test is very important, and also so that is 24-hour evening cortisol test is also very important, and imaging, CT scan, MRI. Okay, so these are the diagnostic measures we are going to use to diagnose the Addison's disease. Now coming to the complications, the most important complications from the Addison's disease is Addison's crisis. Addison's crisis is nothing but severe medical, life-threatening medical conditions. It needs immediate attention. If you are not going to, so that you give immediate care to the patient will collapse at a time, and the coma and so that. Okay, so these are the complications the persons who are suffering from so the Addison's disease. Now coming to the management for Addison's disease. Okay, so management. In the management, so the medical management, so the surgical management, and the nursing management. Okay, so in the medical management, the most important, so that is option is there. There is one is the hormonal replacement therapy, and along with the hormonal replacement therapy, you have to treat the symptomatically and the so underlying the symptoms. According to the surgical management, so there is a, the patient is suffering from adrenal tumors or pituitary tumors. We have to do this. So the for the pituitary tumors, we are going to do this. So transcontinental hypophyseectomy. In the case of so the adrenal tumors, we are going to so do the bilateral adrenal depending upon the so the cause. Now I am coming to the, so that is along with that, so that is the surgical management. We are going to use the radiation therapy because of tumor, so radiation therapy and the chemotherapy. We come to the nursing management. So the role of nursing officer is very important. So the role of nurse is very important for treating the patient who are having the, so that is Addison's disease, because in case of Cushing syndrome, so the hypotension is there. So if we are not going to take a proper care of the patient, then suddenly patient will go. So that is Addison's crisis and coma, and the patient will collapse. Okay, for that reason, so immediate attention is very important. To maintain the fluid and electric balance is very important, and also administration of the so that is drugs, hormones are very important, and along with the monitoring the vital signs are also very important. Now common things, so there is a health education to the patient. Okay, while sending back to the home to the patient, to provide the family, patient and family members regarding to this. So some important information regarding to the diet, regular exercise within his own limit, and medications and regular follow-up. And so one more point, you have to tell the patient to seek medical aid immediately, so that if any discomfort is felt, because if the patient develops adrenal crisis, means it is a very so the medical emergency. For that reason, you have to provide the brief information about the, so that is complication of adrenal crisis. Okay, so this is all about the what adrenal disease.